Max, welcome to committee. Jenna.
House Bill 2390 establishes the Kansas Overdose Fatality Review Board and would exclude tests from the definition of drug paraphernalia to detect the presence of fentanyl, ketamine, flunitrazepam. Hopefully one of the proponents can give a better pronunciation for some of these medical terms than I can, and also GHB test from the definition of drug paraphernalia. Section 1 names this as the Kansas Overdose Fatality Review Act, which would include sections 1 through 3, and defines terms used in the act. Section 2 would establish the Kansas Overdose Fatality Review Board and the mission of that board, which is to make recommendations regarding evidence-based strategies to prevent or mitigate the consequences of drug overdose. The board would have to be established prior to January 1, 2025, and there's quite a few members of the board, so I won't list all of them individually, but kind of give you the broad highlights. The Secretary would establish, and the Secretary of Health and Environment would establish and oversee the board, and there would be 6 members that the Secretary would appoint, who would be the Secretary of Health and Environment or their designee, who would be the chair, and the Director of the Department of Health and Environment's Bureau of Health Promotion, the Director of the Bureau of Epidemiology and Public Health Information, the Department's Program Manager for Drug Overdose Prevention Initiatives, the Department's Program Abstractor for the State Unintentional Drug Overdose Reporting System, the Department's State Health Officer, and then there'd be 10 agencies or boards who are allowed to appoint an individual to represent those boards, including the AG, the KBI, KDEDS, DCF, Secretary of Corrections, Board of Pharmacy, EMS Board, Board of Healing Arts, BSRB, and the Board of Nursing. And then there would be 5 members who are appointed jointly by the Secretary of Health and Environment, as well as KDADs. 4 of those are healthcare professionals, and one of those individuals would be a person who is in long-term recovery, as well as 1 member who is appointed by the Secretary of Health and Environment from nominees submitted by the Kansas Hospital Association, and up to 5 additional members appointed by the Secretary from relevant disciplines. And each of those members would serve a term of 3 years. Section 2 also provides for procedures that have to be developed for data sharing and investigating the drug overdose deaths. Section 3 establishes requirements and duties for the Secretary of Health and Environment, including identifying drug overdose deaths, consulting with members of the board to evaluate those records, and making determination regarding preventability of such drug overdose deaths, and developing recommendations to help prevent drug overdose deaths. The House Committee on Health and Human Services made an amendment to the duties, including disseminating, or they made an amendment to paragraph 8 on on page 4, that would require the findings and recommendations from this board be sent to the House Health and Human Services Committee, as well as the Senate Public Health and Welfare Committee, in addition to various committees and policymakers. Section 3 would also give the Secretary of Health and Environment access to relevant records and sources to complete the duties of investigating drug deaths, and that would include law enforcement investigative records and relevant medical records from individuals who have died of a drug overdose. Subsection E would establish that all of these records that are given to the committee would be confidential, and the confidentiality provisions would expire in 5 years, as is the standard practice in law to make the legislature review those exceptions every 5 years. And the House Committee also made an amendment to this bill that would establish a penalty for an individual who knowingly discloses those confidential records or information, and it would be a criminal penalty, which is a Class A non-person misdemeanor. The penalty typically associated with a Class A non-person misdemeanor would be up to a year in jail and up to a $2,500 fine. Section 4 amends KSA 21-5701, and I believe this is the first conflict resolution bill that we have seen this year, so I'll give you a brief explainer. Last year, we amended the section twice. We were unable to put those into one bill to make them all sync together, and so there are a couple changes in this bill that are already current law, but that we have to put all in the same bill and pass it at the same time to have them to resolve the conflict. So you'll see one of those changes is on page 8, line 42, the definition of drug paraphernalia. And then there is one more change in here that I'll have to remember. I believe it had to do, well, I'll find it for you in just a minute. Sorry about that. But anyway, there is a, oh, it's possession, excuse me, I'm sorry, it's on page 12. The definition of possession is in the broader drug code, not the broader drug code, the broader criminal, Kansas criminal code. And so this definition was duplicative, and so it was removed last year. That's the conflict that's being resolved here. My apologies. But the change made in this bill, so current law provides that any test that is used to detect the presence or strength of a scheduled drug is considered drug paraphernalia. And this would amend that definition of drug paraphernalia to exclude any materials used or intended to use for a test to test a substance for the presence of fentanyl, a phenyl analog, ketamine. The House Committee, the whole added flunitrazepam, which I believe would be Rohypnol, or I think it's commonly referred to as roofies, as well as gamma hydroxybutyric acid, which you might have heard as GHB. It's, in common parlance, a date rape drug. So those tests to detect the presence, I believe they're like little strips that you could put into a drink, or the proponents can probably give you more details, but you would use these little tests to detect the presence of either fentanyl, ketamine, flunitrazepam, PAM, or GHB. And that is the change made by that section of law. The last change is in section 5, it amends KSA 65-16-127, and the main change in this section would be on page 13, subsection D, and it would, so when you typically go to a pharmacy, if you pick up a drug, you can waive pharmacist counseling, and this section would make it mandatory that the pharmacist counsel an individual who is being furnished an emergency opioid antagonist. And so if you are picking up a emergency opioid antagonist, you could not decline pharmacist counseling on the proper use of that, of the Narcan or similar medications. And the last change in this bill would be on page 14 under subsection G. It would add, it would just do some cleanup language there related to first responders, scientists or technician operating under a first responder agency who have responded to a suspected opioid overdose. And I'll be happy to answer questions about the bill.
Thank you, Jenna. Would you repeat that, please? No, just kidding. Do we have any questions from the committee for Jenna? Senator Thompson.
Yeah, Jenna, if I counted correctly, that's about a 21 person board. And these are these people who we would pay to come in on a quarterly basis, pay their travel expenses, per diem, all that sort of stuff?
Yes. So I'm trying to find the exact reference to their. Oh, there you go. My apologies. It's in subsection D of section 2 on page 3, that each member of the board would be paid compensation, subsistence, allowances, mileage, and other expenses as provided in KSA 75-3223E. And this would be the typical statute that's cited for reimbursement for mileage for boards.
Okay. Follow up, if I may. And then with regard to the fentanyl test strips and things of that nature, wouldn't it be much cleaner to put it in a single bill? That's just my question. Rather than pack it in with a bill with a board and all this sort of stuff.
That is a policy choice. Okay. I believe that there have been bills, including a bill last year, that had this, that only amended that section. But this is just a different approach that the requesters asked us to do.
Very good. Thank you, Jenna. Thank you, Madam Chair.
Senator Blasey.
Thank you, Madam Chair. So if I'm understanding this correctly, this bill creates this board, and then it also just says that these test strips cannot be considered drug paraphernalia. Is that it? That's all it does? So it doesn't legalize this test strips?
It would make them so that when they are being used for detecting the presence of one of these drugs, they are not considered drug paraphernalia.
So if a law enforcement officer found some in someone's vehicle or in their presence, that wouldn't be considered an opportunity to further search?
That's a great question, and that would relate to the officer's determination of probable cause. And so in and of itself, the presence of a fentanyl test strip or a GHB test strip would not be probable cause to arrest someone. But if you had other paraphernalia in your car that could be used, the phrase is the totality of the circumstances, it could be considered a factor, and if that makes sense. So by itself, they are not illegal, but if you see fentanyl test strips and you see, I don't know what other paraphernalia you would use to do fentanyl or other drugs, but if there's other things present that gave the officer an indication on perhaps the person's demeanor or other things in the car, that could be used as probable cause as part of that totality of the circumstances to do a search.
So this bill is dramatically different than from the one that was 2 years ago? I thought the one 2 years ago, maybe some of the proponents can answer this, but I thought 2 years ago the bill was to legalize test strips to be accessible to the public.
This would
This
legalize
bill-
them.
And this bill would do that as well?
Yes, but it's not just for fentanyl. This also adds in.
Right, the other ones,
yeah.
Maine and all, okay. All right, thanks.
Senator Steffen.
Thank you. Just to make me completely comfortable that in this bill where they drop the definition of possession, that remains intact
Yep.
elsewhere in the criminal statutes.
Yes, so there are a set of definitions that apply to the entire criminal code, and I could even probably grab the book behind you and find it, but that definition is retained there, and it is stricken specifically related to the drug code, because the definitions that apply to all of Chapter 21 apply also to Article 57 as well as the entire criminal code. So, and that you passed that into law last year. So this just cleans it up, and it would also repeal that statute 215701B, which is the same statute with the changes. So we had to retain both ways that that section of law was amended last year in the statute books, and we just like to clean it up to be all in one, so it's way less confusing.
I don't remember passing anything about that last year. Could you clarify that, what you mean by that?
I would have to look up the exact bill, but KSA 215701 was amended twice last year. It probably would have been part of a criminal bundle. I'm seeing if Ed is here. Okay, if Ed Klump was here, he'd probably remember it. But it struck the duplicative definition of possession, and I can look that up.
The two different definitions.
Yes, so there's the same definition in two places. It was and it was cleaned up, so it would only be in one place.
Thank you. Since we're both in judiciary, I remember us having something like that coming out. And then we have the last question from Senator Erickson.
Thank you, Madam Chair. Thank you, Jenna. Do you know of any other use for fentanyl strips other than to enable illegal behavior?
So I believe that you'll have the proponents testifying about ways to use the strips. We've probably all heard about the fentanyl crisis, to where fentanyl can be located on anything. First responders could use them if they are going into the scene of a crime in order to make sure that the places that they are touching, because a very, very small amount of fentanyl can be deadly. So a first responder could use it to test to make sure that the places that they are touching won't kill them.
Thank you. Thank you, Jenna. For our proponents, you can see we have one opponent, and I think we have 6 proponents. To make sure we allow time for questions, each of you will be limited to 3 minutes, and I appreciate you staying to that so I don't have to slap your hand. Thank you very much. And we're going to begin with Representative William Clifford, MD.
Good morning, Madam
Welcome,
Chair.
Representative Clifford.
Thank you, Chair Gossage and members of the committee. I'm State Representative Dr. Bill Clifford. I'm a board-certified ophthalmologist practicing in Garden City. I'm licensed in 3 states. Importantly, I have a DEA number. I prescribe opioids to about 10% of my surgery patients, so I write over 100 scripts for opioid a year. When I transitioned from the Air Force to medicine, I was an EMT for 2 years. So I've responded to lots of drug-related incidents. That's my credibility today. I won't go through the statistics on the opioid crisis. You'll get that from other conferees, but focus on the fact that 600 Kansans were killed last year from opioids, mainly fentanyl, and over 100,000 Americans. For me, this is personal. I recently attended 3 funerals for young people in Garden City who died prematurely from poisoning with fentanyl-type drugs. I call it poisoning. I've stopped using the language of overdose because language matters. These people had their lives prematurely ended. Our citizens should not face death sentences from these substances. I recently spoke with Tony Mativi, our new KBI director. He assures me we're just seeing the tip of the iceberg on the fentanyl crisis. Drugs along the border are in such oversupply that a hit of fentanyl is under $5. Here in Kansas, it's probably $35 to $50. When these cheap drugs get to Kansas later this year, we will have an increase in deaths in our state. I do think we need the Overdose Fatality Review Board in order to get all the stakeholders in the room and have a data-driven approach to this crisis. As a physician, I do what I can to increase public awareness of this crisis through education. I actually carry Narcan wherever I go, because on an airplane or in a schoolhouse, anywhere you go, someone may be overdosing. I also carry medical-grade gloves because even if the last young lady here left traces of fentanyl, cuts on my hand could expose me and overdose me. It's that powerful a drug. I've checked with the Board of Pharmacy to see whether I can carry fentanyl test strips as part of my Narcan kit. I cannot. I'm a licensed physician with DEA number. It is considered drug paraphernalia in my possession. It should not be because it can save lives. House Bill 2390 passed our House 121 to 0 without opposition from law enforcement. It's a proactive bill and it deserves your support. We face a crisis and need to use every tool at our disposal to save the lives of our fellow citizens. Thank you very much. I'll stand for questions later.
Well done. Next, we have Ashley Goss, KDAG, and Andy Brown, KDADS. Are you coming together or one at a time? One at a time.
One at a
All right, you
time.
each have a minute and a half.
Oh,
No,
boy.
We'll give you 2 minutes.
Okay, it's like, wait a minute, I need to rethink this. All right, good morning, Madam Chairwoman and Committee. Ashley Goss, Deputy Secretary, Kansas Department of Health and Environment. We stand in support with KDADS of this bill because the legislation seeks to place harm reduction tools to reduce overdose morbidity and mortality using data-driven approaches to drug overdose prevention. As was previously mentioned, the House passed this unanimously February 23rd with a couple of amendments that were mentioned earlier. Synthetic opioids are a broad class of man-made drugs that include prescription pain medications as well as illicitly manufactured or distributed opioids. Fentanyl is frequently prescribed legally for pain, but it's also now manufactured to meet the demand of illegal narcotics. Being used, I should say illegally, narcotics are not illegal. According to our Vital Statistics program, we've identified 678 overdose deaths among Kansas residents in 2021. Of that, 42% was an increase compared to the 477 overdose deaths in 2020, 678 deaths in 2021, and of those, 428 involved an opioid contributing to the cause of death. As you may not know, we cannot pull just fentanyl out to look at that death, but we do know it's classified as an opioid death. So decriminalizing the strips would facilitate an increase in fentanyl awareness. As Dr. Clifford mentioned, it's 50 to 100 times more potent than heroin and lethal in minutes. Amending the Good Samaritan law, the legislation would amend existing naloxone access laws so that naloxone can be administered by laypersons should they come upon someone that is non-responsive and appears to be in an overdose state. The board that has been spoken about would consist of multidisciplinary experts, including medical experts as mentioned. The House did also add a member of the Board of Nursing and a member from the Hospital Association to that board as well. And then they also added Rohypnol as one of the approved substances that can be tested for, which is also known as the date rape drug. I'm happy to stand for questions when it's time.
Thank you. And next we have Andy Brown from KDADS.
Hi, my name's Andy Brown. I'm the Commissioner for Behavioral Health Services at ks, and I'm grateful to be here. Chairwoman Gossage and members of the committee, thank you for having us. I wanted to start by saying that fentanyl test strips is a primary harm reduction strategy that's endorsed by the CDC across the country. Many states before us have already took the steps necessary to legalize fentanyl test strips so that they can be used in those strategies. We have federal funding available to help us implement those strategies. And this is really a bipartisan issue that's across the board in our country. Even earlier this year, we had Texas Governor Greg Abbott, who came out and said that he supports decriminalization of fentanyl testing. And that's a reversal of his previous position on the issue. He said that we also need to legalize fentanyl test strips in the state of Texas so that people will be able to test drugs at home to know whether or not it might be laced with fentanyl. He acknowledged that in the past, lawmakers have pushed back against decriminalizing fentanyl test strips, including himself. And he said, I was not in favor of this last session. There's going to be a movement across the state to make sure that we do everything we can to protect people from dying from fentanyl. And I think test strips will be one of the ways that we do that. And I think that we can do that here in Kansas too. I really don't want to have to be the last state that legalizes fentanyl strips. On a personal note, you know, I'm somebody who lives in recovery. I went through treatment many years ago. And if this drug fentanyl had been out on the streets in the way that it is now, I might not be standing here today. So this is something that saves lives. It's something that gives Kansans an opportunity to experience recovery and move on with their lives. It's an opportunity to save children. It's an opportunity to save brothers and sisters and parents. And it's something that we can do for the good of Kansas. So we'd appreciate your support.
Thank you, Andy. And next we have Erica Holliday, Substance Use Coordinator and Unified Government of Wyandotte Public Health Department. Welcome.
Thank you. And yeah, good morning, everyone. My name is Erica Holliday, Substance Use Coordinator for the Wyandotte County Health Department. A little bit about me. I started working in the overdose prevention and recovery access field in 2015. Ironically, that's around the same time fentanyl really sort of entered into the drug use field and scene, and coworkers who had been working in this area for many years had never seen anything like this. People were now not only having behaviors that were more extreme, unmanageable, harder to sort of access into that recovery, but they were also dying at quicker rates and more frequently than we had ever seen before. All right, fast forward 8 years, still a thing, as well as now it has shifted as we're not only seeing people who utilize opioids having the effects of fentanyl, but people who utilize stimulants, people who are looking for counterfeit pills, who have no idea that maybe fentanyl could be, they could even be at risk for overdose. Specifically around youth. In Wyandotte County, our largest increase in drug overdoses have been between the ages of 15 to 25. Frankly, teens have been experimenting with drugs, having one-time uses for 10, 20, 30 plus years, and now fentanyl's a part of the situation. We've been giving education that shows risks for years, and we know that that is not the only thing that needs to be provided. By legalizing fentanyl test strips, we can give people the tools to see if what they're doing, that they're going to do regardless, is safe, and if the test comes back and shows fentanyl, they can take those precautions to change their behavior and stay alive. My work in Wyandotte County, I'm trying to, get people who are in recovery, people who are actively using drugs, and people who are working in the field all in one space to communicate, to advocate, to lift one another up, and to make the recovery access as effective and easy as possible. And I can't do that if people are dying. And frankly, that's kind of the space that we're at right now. By giving these strips, it not only provides trust for people to come to us to say, we can help you when needed. We have the community to provide them to. We can save lives. And then on the review board side, that would provide excellent data to get to know this community even better and to help people enter into recovery long term. So thank you so much, and I'll be around for questions if needed.
Thank you, Erica. Next, we have Libby Davis with Centris Health. Welcome.
Thank you, Madam Chair. Thanks for having me. My name is Libby Davis. I am from Shawnee, Kansas, and a constituent of Senator Thompson. I stand before you today as the mother of a 16-year-old son who, in August of 21, was poisoned by a fake pill. He was a curious teenager and didn't get the opportunity to learn from his mistake. Over the past 18 months, I've learned more than I want to know about illicit fentanyl. You've heard a lot of facts, so I'll just add a few more. It is taking the lives of 200 Americans every day, and the largest death rate growth is happening in our youth. So the scary part of this is that our youth that do survive their experimentation are going to transition into battling addiction, sometimes within hours. It's been described as the deadliest threat to American people, and most ingest it unknowingly. In addition to having a huge impact on our youth, illicit fentanyl is impacting our citizens who battle every day with substance use disorder, and it is a battle. I don't imagine they ever aspired to be in that current situation, but they are. And we cannot forget that addiction is a disease of the brain. Harm reduction is all around us, from seatbelts to sunscreen, and it's about saving lives, and we need to meet people where they're at. Despite much effort by the DEA, our government is unable to stop illicit fentanyl from coming into the country. And if we can't stop it, then we need to use every harm reduction tool we have available. Fentanyl testing strips is one of those. Currently, Kansans can access Narcan as a reactive harm reduction tool to treat overdose. So why would we also not want to make available a proactive harm reduction tool, such as these strips, to prevent overdose? Some may argue that fentanyl testing strips may promote drug use, but the fact of the matter is people with substance use disorder don't have the ability to control their use despite knowing harmful consequences. The drug use is happening, and it will continue to happen. A study on fentanyl testing strips done in North Carolina showed that 81% of the participants did choose to use the strips. 63% of those reported a positive result. And after that positive result, it was shown that those individuals were 5 times more likely to change their drug use behavior and to reduce the risk of overdose. So this is evidence that rather than promote drug use, fentanyl testing strips have the ability to deter or discourage drug use. So if we truly think about who might seek out and use fentanyl testing strips, it's the people who are not only trying to live another day, but who are also trying to avoid another daily battle with an even stronger addiction to a different substance. We should not just be supporting this, we should be applauding it. Lastly, I just want to, I think it's important to note that the CDC does support fentanyl testing strips. They also point out that distribution of these creates an opportunity for people who use drugs to interact with community-based organizations who may offer or be able to connect these individuals with other services and resources they need, including treatment to help them quit. Thank you for your time.
Libby, thank you for being here, and we're so sorry for your loss. Next, we have Seth Dewey.
Good morning, committee, and thank you for letting me speak. So my name is Seth Dewey, and I work for the Reno County Health Department, and I'm also a co-founder of the group, the Kansas Recovery Network. So in my space at the health department, I'm a health educator. I work in substance use grants, and I work with several of our partners from EMS, youth prevention, and also our local law enforcement. As everyone has already pointed out, the data, right? In 2021, we lost 108,000 Americans to overdose, and 60% of those can be attributed to fentanyl. In Kansas, we had about 680. And that made Kansas #2 in the nation for increase and overdose fatalities. The numbers for 2022 were on the same track. And a lot of that is due, of course, as we're talking about, to fentanyl. Excuse me. So fentanyl testing strips can warn an individual of their substance, whether it be counterfeit pills or other illicit substances having fentanyl in them. So in a study done in Rhode Island, over half of the individuals that had access to fentanyl test strips, over half of those individuals altered their using patterns, some of them even discarding the substance. Now think if those 680 Kansans were given the chance to alter their using patterns because of that simple piece of paper to alert them of the presence of fentanyl. Not to mention, for about 62 cents, we're able to make that valuable face-to-face interaction with individuals when that small window of time to potentially bring about a valuable intervention is so valuable. So my most valuable asset to my work that I do is I'm also a person in long-term recovery. And I know that those small windows of opportunity are so important to capitalize on. And if it wouldn't have been for those individuals, particularly peers, to be able to let me know about those resources that were available in our community, I don't know where I would be right now. And those 62-cent pieces of paper are another opportunity for education and opportunities for resources. There's no magic bullet in this fight against fentanyl, but we do have to be able to use every tool available for us. And I do have several parents that ask about the legality of fentanyl test strips. It's not just the individuals using substances. Parents want to know if their children are testing positive for fentanyl as well. Thank you.
Thank you. And finally, of our proponents, we have Michelle Ponce, or is it Ponce?
Good morning. Thank you, Chair Gossage and members of the committee. I am Michelle Ponce. I'm the Associate Director of the Association of Community Mental Health Centers. We represent all 26 licensed mental health centers across the state who really make up the safety net for Kansans with behavioral health needs. We appreciate the opportunity to testify in support of House Bill 2390. Over the last few years, deaths related to synthetic opioids, including fentanyl, have continued to rise. You've already heard from some of the prior conferees about the specific impact to Kansans and that it's anticipated to continue to grow. The majority of our mental health centers provide some level of substance use disorder treatment, and as they transition to certified community behavioral health clinics, they all 100% will be providing this treatment, including medication-assisted treatment, which combines medications with cognitive and behavioral therapies to help individuals recover from addiction, including opioids. As the collective expertise within our system continues to grow, we look forward to the opportunity to work with the proposed Overdose Fatality Review Board and to work closely with them to continue to develop evidence-based strategies to reduce overdose deaths. We frequently hear stories about individuals accidentally overdosing, thinking they were taking one drug when in fact fentanyl or another synthetic opioid was what they were really ingesting. It takes only a minute amount of fentanyl to be fatal. We must employ a variety of strategies to decrease this risk of overdose death. Fentanyl test strips have been shown to be effective in detecting even traces of fentanyl. It is a low-cost, easily accessible tool that can save lives. In summary, we believe that prevention should be a key component of the behavioral health strategy for our state, and that House Bill 2390 at its core is prevention-oriented. Thank you for the opportunity to provide testimony, and I would be happy to answer questions at the appropriate time.
Thank you. In committee, we only have one opponent, so I'm going to go ahead and have the opponent who's on WebEx give his 3-minute testimony. I'm sorry. Oh, you're here. Okay, I apologize. I had you down as WebEx. Nick, welcome to committee, and you have 3 minutes.
Thank you, Madam Chair. Yes, I was going to, my name's Nick Reinecker from Inman, Kansas, and I was going to be on WebEx, but I thought it was the importance of proving a point about the compensation of this board of, say, my personal investment in this, of driving 200 miles today to come testify is more important than me getting compensated. I'm an opponent to this bill because I think it should be two bills. I think the board aspect of it should be its own bill, and then the fentanyl strip should be its own bill. I'm concerned when we talk about more growth of government. We've had issues of that with the Kansas Fights Addiction Act Grant Review Board, the Kansas Lottery Act, and the Crisis Intervention Act, and all these things growing government and how they come to play with diagnostic tools to get people a diagnosis and then medication-assisted treatment and therapies and everything like that. And then my concern is, I think maybe one of the things the board is going to tell you is that you need to expand Medicaid after they study some of these deaths, and I'm not a fan of that. Then when we talk about the fentanyl test strips, I went to a meeting in Wichita last year where a lady was there and said that she had had a non-fatal overdose on crack cocaine, and she was saying how that she would like these fentanyl strips legalized so she could test her. She didn't know that she was doing fentanyl. She thought she was doing crack cocaine. And so it opens up that whole, where are we going to go with this? And as most of you know, I've been coming up here for the last 10 years trying to get cannabis off the Controlled Substances Act and make the possession of cannabis not a crime. And so if there would be something that you could do for free that wouldn't grow government, that would allow harm reduction to be done on a natural level, and notice we are talking about synthetic opioids, not natural substances, that we should do activities like that and not go down these deep rabbit trail holes and everything like that. You have my testimony. I put underlined some things about the different Kansas Fights Addiction Act, the Kansas Lottery Act, and stuff there in my testimony, and where the money goes and how much little money goes to actual problem gambling and addictions. Most of it goes to bullying, natural occurring substances. Thank you for allowing me to speak today. I was a little rambling. I apologize for that, but I just walked in the door from being outside in the rain. So thank you for your patience, and I'll stand for any questions.
Nick, thank you. Committee, we have about just under 15 minutes for questions, and we'll begin with Senator Petty.
Thank you, Madam Chair. And this is a question for Libby Davis. Mrs. Davis, thank you for being here, and so sorry about your loss of your son. But I know you've become quite an advocate working not only at the state level, but at the federal level. So could you share with us some of your advocacy that you've done with our congressman?
Yeah, I'd love to. So Senator Roger Marshall has a bill that's being looked at right now. It's called the Cooper-Davis Act. We're very honored that he asked to put Cooper's name on this bill because we believe in anything that will save lives, not just this bill, but also fentanyl testing strips. This bill is designed to hold social media companies accountable for the illegal activities that happen on their social media apps. It just increases the accountability and puts hopefully some safeguards in place, but I think it's important to know that the Mexican drug cartels have a business plan. They were smart, it's working. They were smart in using fentanyl because it's cheap, it's odorless, tasteless, easy to get across the border, highly addictive. Their business plan is working, and they're using our own smartphones, our own social media apps to get to their buyers.
Thank you.
Senator O'Shea.
Thank you, Madam Chair. I'm not sure who my question's for. Can I ask it and then we decide who? The opponent, Nick, brought up a good question that I've always had is, how do we decide, you know, we've got so many boards and task force and committees, and when do we decide whether they're paid or not? I know at one point I was on a task force and it's like, oh, that one's not paid. And so how do we decide that? How much are they compensated?
I will just say, it does say in the supplemental note that there will be compensation, the mileage reimbursement. If you'll look on page 5 of the supplemental note, subsistence allowances, other expenses is provided in statute. So I'm assuming that that's in statute, so maybe Jenna can help us, and she's looking furiously here. So we'll give you a minute to do that, and we'll go on to another question. Oh, you have it, okay.
So who gets to decide that? And when you all get to decide. You can say that they're paid, not paid, certain people are paid, certain people aren't paid. But this references the statute 753223, and it would allow $35 a day for actual attendance, plus mileage is provided in the subsection, and then expenses. I'm guessing that'd be things like tolls. And if it was a 2-day meeting, I don't think that they would have 2-day meetings, but if you're often on committees, we have 2-day meetings, and it would pay for a certain amount for your overnight stay.
I have a quick question, and that is regarding this board. When I counted about 26 potential members that would be on this board. And it looks like we're going to be looking into overdose fatalities. And how is that information, that data kept today? Can somebody from the department answer that for me?
Hi, Ashley Goss, Deputy Secretary, KDHE. You're talking specifically the statistics that we mentioned. That's part of the, I'm not going to be able to tell you the name of the report now, but we track all of the different deaths that come in based off of what the code is on the death certificate, the cause of death. And so then it's tracked that way. It is tracked confidentially. There are no names associated back to it. We do report it out in our annual summary. That is the name of the report of how many people have died of different types of causes of death. So cancer, in this case, opioid overdose, several different things, several different diagnosis codes. Does that answer your question?
So how would it change to have this board?
So the way it would change is, so if any of you are familiar with our Maternal Mortality Review Board, I'm looking at Senator Baumgartner, I think she's familiar with that board. We have an extractor, a medical records extractor that can pull the pertinent information to review why, like in this case for the maternal mortality, we're looking at what the missed opportunities were or why mom passed away when we're looking at a death review in that situation. So for example, in that review board, we're looking like, was there a missed chance or missed chances for behavioral health? Did they need that service? Did something medically happen? So we're reviewing that. This case, same type of situation, medical reviewer would extract the pertinent information to be able to determine what maybe the missed opportunity was, why they died of the opioid. Is it an overdose situation? Was it a misuse of the drug, taking it? Maybe it was someone who thought they were taking it appropriately and they overdosed accidentally, not illegally, as that's why we want our the fentanyl strips legalized. So it's taking a deeper dive into that information. We cannot obtain that information currently, nor would we without the review board. And then all of the HIPAA practices come into play. Confidentiality notices have to be signed. The information is kept confidential at all times.
Thank you. Jenna?
Thank you, Madam Chair. I forgot to add one thing, that pursuant to this statute, no per diem compensation shall be paid under this section to salaried state officers or employees. And so the about first 15 members of the committee, they're all state employees. They would not be getting the mileage or per diem rate. So the Attorney General, everyone who works for the Secretary of Health, they would not be getting extra compensation to attend meetings as part of their job.
Senator Thompson.
Thank you, Madam Chair. This regards the legalization of the fentanyl strips. To me, it seems like we need to strike a balance, and I don't know who can answer this, to provide law enforcement some backup, but still allow for parents to be able to have access to this stuff, or somebody who could monitor someone using drugs. Would this still, if they could purchase, if we were to legalize these, would it still be tracked by K-Tracks? Would someone have to have a prescription to do that? In other words, say a parent was worried about your situation, Libby. Could they go get that at a pharmacy, but still have the pharmacy track it on K-Tracks? So that there's some kind of a system that tracks who has these test strips, what they're being used for, but not place such a high hurdle in the path of somebody who needs to do that because they may be worried about what kind of drugs are being used. I'd like to know, because I think that to me is the crux of this problem. You know, how do we make it accessible yet still track it in a way that law enforcement can say, yes, they're supposed to have that. They are not an illicit drug dealer or something of that nature.
Senator,
anybody can answer that. I think that's
we don't
nut of
have
this bill.
anybody here from law enforcement, but I see Representative Carpenter with his hand raised.
Thank you, Madam Chair. Representative Bill Clifford again, State House. Individuals accessing these strips do not want to be perceived as users. So if we have a mom who's concerned, and we had a conferee in the House committee, they went out dancing for her daughter's party, and while they were dancing, they saw a guy drop pills into their drinks. That mom saw that, and that man was withheld, and then law enforcement tested the drinks, and the date rape drug was in them. So I don't think folks want to be tracked or need to be tracked. They just need the tool to prevent these overdoses and deaths.
So would it be like an over-the-counter type of purchase?
From Canada, you can already order fentanyl test strips over the internet. It's illegal, of course, to possess them. You can get the date rate GABA test strips actually in Lawrence, Kansas right now. So yes, it would be over the counter.
Thank you, Representative Clifford.
Thank you.
The next question comes from Senator Baumgartner.
Thank you, Madam Chair. I'm not saying how would this work? How would this review board work in conjunction with our state child death review board? Because many of the deaths that they're addressing from that Venn diagram would be overlapped. So how would these two boards work together?
Ashley Goss, Deputy Secretary at KDHE. I think that's a great question and a great call out, Senator. That's something that we can definitely address and figure out where the crossover is but also ensuring that we're maintaining the confidentiality of the two working groups. But I do think that there's definitely crossover in that, in those two review board pieces. So in other words, if this passes and we can get this through, that'll be one of the things that we establish as to where might some of this already be lying and who else, or what do we need to pull out so we're not doing duplicative things.
And Madam Chair, I think that's one of the things that's really been missed because the State Child Death Review Board has been addressing this. I think what hasn't been shared is that lag or that delay in the information they receive, but all of the information they receive and that they work with is confidential. Thank you, Madam Chair.
If you could come back up to the microphone. I'm just trying to understand, because as you know, I serve on some of these boards as well, and I'm not sure exactly why we need the board for you to be able to do this, quote, deep dive, to have 21 people come together. Could you explain that to me?
Sure. The outcome of the reason for the board, number one, is because, first of all, we want to legalize fentanyl testing strips so we can hopefully stop opioid overdose. But at the end of the day, we still want to be able to get people directed into treatment that want treatment, get people directed with the education piece of it. So until we can really figure out the why behind it, we know fentanyl is causing people to die because their illicit drugs are laced with fentanyl. We know that. But then the next piece of that is, why are they turning to this substance? What else are we lacking in services? Where else do we need to direct them in communities? So, and Andy can probably talk more about the behavioral side of it than I can. But that's what we're looking at, is at the end of the day, we want to figure out how we can prevent these things and help work to treat addiction, I should say. We're not going to prevent addiction, but how can we treat and manage addiction?
So then, in the department, you receive a list, anonymous list of the death certificates. And let's say 20 of them say that they were an overdose. And currently you just write down, we had 20 deaths that were due to overdose. Is that correct? But if you had the authority, then you would do what? You would find out the names of these people, you would reach out to their families. How else could you begin to know the motive or why they did this?
No, we would not be reaching out to someone specifically or to the families. What we're doing now, we're looking at it from a systematic approach. So if it's an opioid death and then it's determined it's opioid that was laced with fentanyl, so the fentanyl death, regardless, whatever we're looking at, I should say, opioid deaths broadly. So we might start to see a trend, like, I don't want to pick on any section of Kansas because all of Kansas is amazing, but let's say we find a pocket to where there's an excessive amount of opioid deaths, then we're going to deep dive into that more, looking at what's missing in the system or what could be causing this. Libby pointed out the Mexican drug cartel that's coming up. Okay, is this a targeted area of where they're working? I mean, we want to look at it to see if there's preventative things that we can do, if there's system approaches that are missing for treatment opportunities, and just what the big picture is. But we would never go back to a specific family or a family member at all. All of that remains anonymous. We would not know that information. We're looking at trends and options. Andy may have more to add to that.
That's all right. We are very short on time, so I have two last questions. So that would be Senator Holscher.
Thank you, Madam Chair. My question, I'm going to direct it towards Brandy Harris, if I may, who was going to testify. There she is. Brandy, my question is this. My understanding is that fentanyl is an odorless, colorless poison. And I know you have a personal situation. You know, what are the other tools out there that could have helped you, or are the test strips basically the tool that we have at this point?
Well, I know that I didn't get to testify, but so my son overdosed in April, and he was 3 years sober when he did this. And so I think that he was unfamiliar with product and what was out there, what was available to him. And the person that he got it from wasn't somebody that he had used to get it before. And according to the police officers that were there on the scene, it's almost impossible to tell what it is, except for that it's a little bit more clear than other things. And so they had to send it in and have it tested. They couldn't test for it right then when the EMTs got to the house. They couldn't test for it right then. And I think that being able to test for it right away might be able to help them in knowing how to administer some sort of treatment.
Thank you. And I would just say, Brandy, I note that you requested that you specified written-only testimony.
Okay.
Which is why we did not have you come to the microphone.
I didn't specify it all, and I realized that when I edited it, I didn't put in-person testimony, so I didn't specify it all. So that was my fault. When I edited it, I didn't put in-person. I'm sorry.
No, you're perfectly fine. And then we'll go on to the next question. Senator Stephan.
Thank you. I'll probably direct this at Representative Dr. Clifford, because I understand, and correct me if I'm wrong, but you're also the Republican county chairman. Is it Finney County?
That's correct. Dr. Clifford, State Representative.
Okay, so I have no doubt you're very sensitive to growing government. And clearly we've clearly defined this as a great big board that does get compensated and it just creates another layer of bureaucracy. Now, when you whittle down through this big board, it really kind of comes down to their directive is to make recommendations regarding evidence-based strategies to prevent or mitigate the consequences of drug overdose. And then when you look on the list of people who are to be on this committee, you have a person whose job title is Program Manager for Drug Overdose Prevention Initiatives. So how do we square together this creation of this monstrous, expensive board with full of bureaucrats when we clearly already have a platform to do this? And I do have a quick follow-up.
Senator Stephan, Madam Chair, there are epidemiologists on their board. There are people with domain-specific knowledge. That person in particular would use this data and this evidence-based information to do marketing education of the public.
Okay, it looks very redundant to me. Now, the quick follow-up question, maybe this goes to Ashley Goss, but what we see in her testimony is that we had very few fentanyl overdoses, even up to 2019, but in 2021, it is blown up. Do I have to tell everybody why, or do we all know? We've got an open southern border, and we've got a presidential administration that's not doing their job to prevent the flow of narcotics into this country, and here we sit trying to solve the problem downstream.
Senator Stephan, I appreciate that. Do you have a question for her before we go?
Do you recognize that what the source of this monstrous exponential increase in deaths is from?
Senator Stephan and Madam Chair, we're all border states now, and this is a war. Thank you.
Thank you. Committee, we will not have committee tomorrow. We will have a full week, Monday through Thursday next week. Also, come prepared to work bills each day of next week as we also have hearings. This closes the hearing on HB 2390. Committee, we are adjourned.